Tonight in Medical Rounds, the Heart Vascular Institute at Hartford Hospital has been selected as one of only 35 hospitals in the country to participate in a study involving a minimally invasive heart procedure for low-risk patients with something called severe aortic stenosis. And joining us live is Dr. Francis Kiernan, director of the Cardiac Catheterization Lab at the Heart Vascular Institute at Hartford Hospital, to tell us more about this fascinating study. Good evening, Dr. Kiernan. Thanks for being with us tonight.
Good evening, Denise.
First, let's talk about aortic stenosis. What is that?
Sure, Denise. The aortic valve basically functions as a doorway that has to open so the heart can pump blood to the rest of the body. In aortic stenosis, this valve becomes thickened and calcified and doesn't open properly. Basically, the heart is pumping blood through a pinhole. This can cause many symptoms such as chest pain, shortness of breath, or even passing out.
Well, tell us about the TAVR procedure, and it's known as TAVR. It stands for Transcatheter Aortic Valve Replacement. I did that for our viewers so they could ask about it.
Yes.
What does it entail?
Good job.
Thank you. What does it entail, Dr. Kiernan?
Well, the treatment for aortic stenosis involves replacing the valve. For many patients, the risk of open heart surgery is high, so they are not good candidates for surgery. Therefore, TAVR has been developed in which the valve is replaced using minimally invasive techniques through very small catheters. This usually results in a shorter hospital stay and a quicker recovery for these people.
Well, that's wonderful to hear if you're the patient. Now, the cardiac team at Hartford Hospital has been performing TAVR for many years, and I understand you just marked an impressive milestone. Tell us about that.
Yes, we did, Denise. We've been performing TAVR at Hartford Hospital since 2012. Our team that consists of interventional cardiologists and surgeons has recently treated our 800th patient.
Wow, congratulations. That's great to hear. And then let's get back, as we have a few seconds here, to the study that Hartford Hospital will be participating in. What is the goal of the study? Tell us about that.
Yeah, TAVR has been shown to be effective for patients who have an elevated risk for cardiac surgery. We've been selected as the only site in New England to participate in this study that will evaluate the effectiveness of TAVR in patients who have a low surgical risk. These patients will have TAVR and be followed for several years to see if this technique compares favorably to open heart surgery.
Wow, this could be a very, very important study. We thank you so much, Dr. Kiernan, for sharing this great information, and keep up the great work there. Now, if you at home would like to learn more about this procedure, TAVR, T-A-V-R, or maybe you need a